Thymus and bone marrow are primary lymphoid organs where T lymphocytes and B lymphocytes mature respectively. Both T cells and B cells are richly populated in secondary lymphoid organs. They are spleen, lymph nodes, and mucosa associated lymphoid tissue, tonsils, appendix, and Peyer's patches. Thymus is bilobed organ. When small part of it is processed for histological section, it shows small lobules. Every lobule has its own cortex, which is darkly stained, and it shows medulla. Medulla is lightly stained. Interestingly, medulla of all the lobules are continuous, and it's one. Here it is capsule. It sends septae or trabeculae inside, which divides into different lobules. Skeletal framework of thymus is different from spleen and lymph node. Let us quickly recall how it is in spleen and lymph node. There is outer fibrous connective tissue capsule and trabeculae which run deeper from the capsule. Parenchyma is supported by meshwork of reticular fibers in spleen and lymph node. But in thymus, parenchyma is supported by meshwork of reticuloepithelial cells, not by reticular fibers. Here we see capsule, trabeculae, network of epithelial cells, they are reticuloepithelial cells. Thymocytes are densely packed in the cortex of the lobule and they are sparsely arranged in the medulla. Let us zoom in. Thymic capillaries in the parenchyma are covered on their outer walls by reticuloepithelial cells. This is how they form blood-thymic barrier. This barrier protects the thymic parenchyma from antigens which can take entry from blood. This is how thymus is antigen-free zone, which is necessary for maturation of T lymphocytes. In the medulla, degenerating reticuloepithelial cells can form concentric lamellated bodies, Hassel's corpuscles. These are features of identification for thymic tissue. This is how they appear: concentric eosinophilic lamellated bodies. This is H&E stained thymic tissue, shows capsule, trabeculae, dividing the thymic lobe into different lobules. Every lobule has its own cortex, darkly stained, and medulla, which is lightly stained. Medulla is continuous in all the lobules, and medulla shows Hassel's corpuscles. Reticuloepithelial cells are not seen in this power. Supportive structure of the lymph node, capsule, and trabeculae. Extension of the capsule are trabeculae. Reticular fibers are not seen in H&E. They are in mesh, holding the lymphocytes inside. Parenchyma is cortex and medulla. Cortex is darkly stained with lymphocytes. Medulla is having medullary cords and sinuses. This is subcapsular space. These are paratrabecular spaces or sinuses. And these clear spaces are medullary sinuses. Cortex has lymphatic follicles or lymphatic nodules. In the medulla, we find medullary cords and medullary sinuses. Lymphatic follicles are of two varieties: primary follicle, secondary follicle. These are also known as lymphatic nodules. Secondary follicle has pale center. This is called germinal center. This happens after antigenic stimulation. This is called activated lymphatic nodule. Secondary follicle having pale central zone, that is germinal center, and darker peripheral zone, that is mantle zone. In the mantle zone, resting B cells are there. In the germinal center, clonal differentiation is happening. B cells are dividing, so they have pale staining. At the junction of cortex and medulla, we find paracortex, which is richly populated with T lymphocytes. Diagrammatic representation of capsule, trabeculae, outer cortex, inner medulla, paracortex. Parenchyma shows lymphatic nodules, primary and secondary lymphatic nodules. Subcapsular sinus, paratrabecular sinus, medullary cords, medullary sinuses. Spleen is a hemolymphoid organ which filters blood. So it is highly vascular. But still, when we take section through a fresh spleen, we see many white spots. All these white spots are white pulp. Rest of the area is red pulp. This is histological section of spleen stained with H&E. The skeleton of the spleen is made up of capsule and trabeculae. and central part it is made up of meshwork of reticular fibers which are not seen in HND. The parenchyma of the spleen is divided into white pulp and red pulp. At white pulps, it shows lymphatic aggregation. In the red pulp, it shows splenic sinusoids and cords. We can see in the pulp, the splenic artery is covered by a lymphatic sheath around them. So these are called periarterial lymphatic sheath, which makes white pulp. So these are the white pulp, periarterial lymphatic sheath with eccentrically placed arteriole. Rest of the area in between these white pulp is all red pulp. And the surface of the palatine tonsil is lined by the oral epithelium, that is stratified squamous non-keratinized epithelium. It shows many crypts. On one side it is capsulated, so it is also known as semi-capsulated. This is histological picture of the palatine tonsil. One side it is capsulated, so we can see the lining epithelium and crypts, they're clear spaces, and just below the epithelium we are seeing lymphoid aggregations or lymphoid follicles, which are primary and secondary lymphoid follicles. Sections sometimes show glandular tissue and skeletal muscle fibers. This is diagrammatic representation of palatine tonsil. Identification features are lined by stratified squamous non-keratinized epithelium. It shows crypts, and just below the mucosa, just below the epithelium, we see lymphoid follicles. They can show primary and secondary follicles with germinal centers. Sometimes acini or glandular part and skeletal muscles can also be seen.